Okay, this is my quick and dirty documentation for acute care and also for inpatient rehab for evaluations. And so let's pretend this is a quadrant of a paper. I would normally just fold it over like this one. So quadrant, quadrant. These are my treatment notes. This is how I format it. Maybe I'll do a video on that later. Let me know if you'd like to see that. But for the evals, I use a full quarter of a page for each eval. So let's pretend this is a quarter of a page. I start with just doing a line up top. And so I do the room number, I do the patient name, I write whether they're male or female, and then the patient ID number, because the hospital wants me to double check that that I've got the right patient, and so I always write that there. Sometimes if I want to, I'll do either their birthday, I'll put their diagnosis up here. Maybe they had a stroke, and then I can put the time of my session here. If it's inpatient rehab, I'll put the time over here. If it's acute, then I don't worry about it. But I might also put a note over here, like if they're on isolation because of COVID or because of MRSA or whatever reason they're on isolation. So if I have any notes about that, then I'll put it up here. And then I go ahead and divide my paper into a tic-tac-toe. And that gives me 9 boxes that just help me keep on track. I'll give you more information on each box specifically in a longer video, but just really quickly, here's what I use each box for, and this helps me stay on track really easy. This is just a super easy way to not have to print anything off, but I'm ready to go see patients and I stay on track and I get the information I need to. So this box is for their home setup. I ask about, how many stairs, bathroom equipment, other equipment that they have at home, who they live with, pets, what's their home situation. Here is their previous level of function. So how were they doing before all of this? Were they independent? Then they need a little bit of help. Were they driving? How are their IADLs? That's all in this box. Now, how are they doing now? They've got to the hospital, they've had a stroke or whatever it is. So how much help are they needing with all their ADLs now? Over here, I also talk about, are they walking or standing, or are they still in bed bound? How much help do they need to get up and moving, basically? For this box, this is kind of my MMT, my range of motion, my tone, my sensation. So I'm checking, mostly I do upper extremities in my facility, the PTs do lower extremities, and just for sake of efficiency, I don't double do what they do. But in some facilities, I sure might include the lower extremities down here as well. So if they're left-hand dominant or whatever, I might circle that. But here's where I talk about tone, sensation, MMT, ROM. This is the box for cognition. I'm checking their brain. I usually do a little memory screening. I'm also checking their vision and their hearing, if that's relevant, kind of neurology. All of the neurology is here if we're looking for saccades or anything else with a stroke. We're just checking all of that out here. Just moving on down. This one I use for goals, and I do this after the session. I step out in the hall and I kind of think, okay, where do I think they can get to? And it's just helpful to already have those written down rather than trying to remember them at the end of the day when I'm doing documentation. This box I use for any vital signs that I might take. If the nurse comes in or needs to give them meds, I might make note of that here, or anything that happens as far as just keeping them alive up here. Here I write down education provided. That's really important to my facility, but also to insurance carriers. And so I'll always note, even if it's little things about put your hand here to get from lying to sitting on the edge of the bed, any education should go in here. And then this box is super, super important because this is your productivity, and your facility really cares about that before they give you a paycheck, unfortunately. So this is your time in, maybe 8:31 is when you went in, and you come out at 9:12. So time in and out, super important for you to keep track of that. So that's where I keep it on this paper. And then safety is the other part that goes in this box. And this is how I leave the patient. And so I always make note of whether I left them in bed, in the recliner, did they have an alarm, did they have a call light with them, did they have their needs within their reach. However I left them, I document it here so I can put in my notes so that people know that I'm keeping my patient safe so I don't get blamed in any future lawsuits, kind of a thing. So this protects my patient, but also my own. Yep.